What is bloodborne pathogens? Bloodborne pathogens are microorganisms that are present in human blood and can cause disease in humans. These pathogens include viruses such as hepatitis B, hepatitis C, and HIV, as well as bacteria such as syphilis and tuberculosis. They can be transmitted through contact with infected blood or other bodily fluids, and can lead to serious health complications if not properly handled and treated. Preventing exposures. There are several ways to prevent exposure to bloodborne pathogens, including wearing personal protective equipment, PPE, such as gloves, masks, and goggles when coming into contact with potentially infected blood or bodily fluids. Properly cleaning and disinfecting surfaces and equipment that may be contaminated with blood or other bodily fluids. Practicing safe injection techniques and properly disposing of needles and other sharps. Following standard precautions for all patient interactions, including using barrier protections such as gloves, gowns, and face shields. Immunization against certain bloodborne pathogens, such as hepatitis B. Proper hand hygiene and avoiding any kind of personal contact with blood or other bodily fluids. Strictly adhering to infection control practices and procedures. Being aware of potential exposure risks and taking immediate action if exposed to blood or other bodily fluids. Strictly adhering to infection control practices and procedures. Being aware of potential exposure risks and taking immediate action if exposed to blood or other bodily fluids. Regular training and education on the handling of bloodborne pathogens. It is important to note that it is not just healthcare workers who are at risk of exposure to bloodborne pathogens, but also individuals in other professions such as emergency responders, laboratory workers, and mortuary workers. How infections occur. Infections from bloodborne pathogens can occur when an individual comes into contact with infected blood or other bodily fluids. Some common ways that this can happen include needle sticks or other sharp injuries. This occurs when a person is accidentally poked by a needle or other sharp object that is contaminated with infected blood. Mucous membrane exposure. This occurs when an individual's eyes, nose, or mouth comes into contact with infected blood or other bodily fluids. Open wound exposure. This occurs when an open wound comes into contact with infected blood or other bodily fluids. Sexual contact. This occurs when an individual has unprotected sexual contact with a person who is infected with a bloodborne pathogen. Mother-to-child transmission. This occurs when a mother who is infected with a bloodborne pathogen passes the infection to her baby during pregnancy, childbirth, or breastfeeding. It is important to note that not all exposures to bloodborne pathogens will result in infection. The risk of infection depends on several factors, including the type of pathogen, the amount of blood or bodily fluid to which the person was exposed, and the overall health of the person exposed. It is also important to note that bloodborne pathogens can also be contracted through using contaminated equipment such as needles, or sharing personal grooming items with an infected person such as razor, toothbrush, broken glass, or other sharp object that has been contaminated by infected material. Wearing personal protective equipment, PPE, such as gloves, masks, and goggles when coming into contact with potentially infected blood or bodily fluids. Properly cleaning and disinfecting surfaces and equipment that may be contaminated with blood or other bodily fluids. Practicing safe injection techniques and properly disposing of needles and other sharps. Following standard precautions for all patient interactions, including using barrier protections such as gloves, gowns, and face shields. Immunization against certain bloodborne pathogens, such as hepatitis B. Proper hand hygiene and avoiding any kind of personal contact with blood or other bodily fluids. Strictly adhering to infection control practices and procedures. Being aware of potential exposure risks and taking immediate action if exposed to blood or other bodily fluids. Regular training and education on the handling of bloodborne pathogens. In addition to universal precautions, there are other specific precautions such as airborne precautions, droplet precautions, and contact precautions. Airborne precautions are used to prevent the transmission of airborne pathogens like tuberculosis, chickenpox, and measles. Droplet precautions are used to prevent the transmission of pathogens that can spread through droplets, such as influenza and streptococcal pharyngitis. Contact precautions are used to prevent the spread of pathogens that can be spread through direct or indirect contact, such as methicillin-resistant Staphylococcus aureus, MRSA, and Clostridioides difficile. These specific precautions may include additional PPE, environmental cleaning, and other infection control measures. Responding to injuries. Wash the affected area with soap and water immediately, if possible. Seek medical attention as soon as possible. A healthcare provider will be able to assess the risk of infection and provide appropriate treatment, including post-exposure prophylaxis, PEP, if necessary. Report the incident to the appropriate authority, such as an employer, school, or other governing body. Document the incident, including the date, time, and details of the exposure, as well as any actions taken. Follow up with healthcare provider for testing and monitoring for possible infection. It is also important to note that if the exposure occurred in a workplace setting, the employer should provide the healthcare and support, including covering the cost of medical evaluation and treatment. It is also important to be aware of the signs and symptoms of bloodborne pathogen infections, such as hepatitis B and C, and HIV, as these may not appear for several weeks or even months after exposure. Cleaning up potentially infected materials. Wear personal protective equipment, PPE, such as gloves, masks, and goggles to protect yourself from exposure. Use a solution of household bleach and water, 10% bleach solution, to clean the affected area. Allow the solution to sit on the surface for at least 10 minutes to ensure that it has enough time to kill the pathogens. Use a clean, damp cloth to wipe away the bleach solution and any visible debris. Dispose of all cleaning materials and PPE in accordance with local regulations for handling biohazardous waste. Clean and disinfect any equipment that may have come into contact with the potentially infected materials, such as mops and brooms. Thoroughly wash your hands with soap and water after removing your PPE. Safety tips. Don't eat, drink, smoke, apply cosmetics, or handle contact lenses until you have thoroughly washed your hands. Report every incident that involves exposure to blood or bodily fluids to your supervisor or manager immediately. By always taking universal precautions and using common sense, you can prevent almost all exposures to bloodborne pathogens. When removing disposable gloves, roll the first glove off the hand inside out. Use the clean inside part of the first glove to remove the second glove. Never wash or attempt to disinfect disposable gloves. They must be placed in an approved biohazard bag. Wash your hands immediately after removing any gloves. In conclusion, bloodborne pathogens are microorganisms that can cause serious health complications if not properly handled and treated. To prevent exposure to these pathogens, it is important to follow universal precautions and other specific precautions, wear appropriate personal protective equipment, practice safe injection techniques, and follow proper cleaning and disinfection procedures. It is also important to be aware of potential exposure risks and take immediate action if exposed to blood or other bodily fluids. Remember that both employers and employees have a responsibility to ensure a safe working environment and should be aware of and follow policies and procedures to reduce the risk of exposure to bloodborne pathogens. Regular training and education on the handling of bloodborne pathogens is also essential for preventing exposure and maintaining safety in the workplace. Thank you for taking the time to read and learn about the importance of preventing exposure to bloodborne pathogens. It is crucial for individuals to be aware of the risks and to take the necessary precautions to protect themselves and others. Remember that early detection and timely treatment can prevent the spread of infection and minimize the risk of serious health complications. We hope that this information has been helpful, and we encourage you to continue to learn more about bloodborne pathogens and how to stay safe in the workplace. Thank you for watching.